Welcome to Consulting Chike and welcome to yet another episode. And this time I'm going to talk about committees which is related to NABH. So this will be in three parts. So this is the first part, and in subsequent weeks I'll be releasing those two other parts. So let's start. So the contents are first I'll start with introduction, then why committees are required, then the working mechanism of committees, then ensuring the continuity of committee work, and then I'll start with committees. So this time I'll cover three committees: BMW, infection control, and then medical records. So this is how the structure of committees are. So you have to see the YouTube video to see the whole picture. So on top you have the management committee, right down you have the quality committee, and then you have all the other committees. So the committees are like clinical safety, clinical and patient safety committee related. Those are like infection control, mortality, code blue, clinical audit, support and diagnosis by BMW, MRD, blood transfusion committee, condemnation committee, your medication and asset risks like drugs and therapeutic committees, risk and safety committee, your equipment purchase committee, then governance and ethics, you have disciplinary committee, you have ethics committee, you have grievance committee, you have wash committee. So committee is the whole thing about this is it's a system driven and team based process. So there are several number of things, there are thousands of things that needs to be done in a hospital for improvement when you're doing NABH quality implementation. And it does not end there. For the operational purposes and for all kind of improvement activities, the committee, they are the ones who will be driving everything. So a system based process. Then it is the backbone of governance, compliance and quality improvement. This is where all the decisions are taken, and certain decisions which are like very difficult and those which requires management, the owner's involvement, it all goes up to the management committee. The whole committee thing, it is about having a culture of safety, accountability and continuous improvement. So the whole mechanism, I'll tell about that, how this thing is done. So basically what we need to understand is committee, it drives everything. Okay. Why committees? Why do we need to have committees and why do they need to have their meetings, do their work? Why? Number one, multidisciplinary involvement. So the committee, each committee, they have people from different disciplines like doctors, nurses, from administration, certain technical people, even in certain cases advisors from outside. Okay, which helps you take a multidisciplinary approach in resolving certain issues. Ownership and responsibility. The chairman, the secretary, all the members, invitees, they all have certain roles to play. Okay, which is all laid down in the terms of reference. Cross-functional coordination. Of course, these interdependent departments, they all need to come together and take a decision. So if you don't have committees, what happens is these departments, they work in isolation. They are not communicating. The problem of ineffective communication is very commonly seen in all hospitals. So committee exercise, it breaks that. It gives a platform for departmental discussions. Then decentralized decision making. So without committee, all decisions may be there in one person. Okay, without the permission of that person, nothing moves. So when you have a committee, then the committee chairman, they take responsibility. The committee members, they take responsibility of those decisions. Okay, so once a committee decides, then things are decided and things move in that manner. Then continuity despite staff changes. So committee basically gives a structure of framework to do work. So even if somebody goes, that position is replaced, and the committee in unison, they pull that new member and engage in how a committee functions. Okay. Then enhance evidence-based compliance through documentation and records. Committee maintains MOM and it is distributed. Now, the working mechanism of committees. So committees works in terms of their terms of reference. So what they are supposed to do and everything, their activities, their agendas, everything is mentioned in the TOR, that is terms of reference. Then there it also covers the roles and responsibilities. So what a chairman is supposed to do, what secretaries they are supposed to do, what the members they are supposed to do. So in general, chairman will have a veto power, and secretary, they are supposed to record the MOMs circulated and ensure that the work is done. The legwork needs to be done by the secretary. Then comes the committee meetings with fixed frequency. So all committees, they'll have a fixed frequency of meeting. Some committees will have monthly, some will have quarterly, half yearly, annually, as and when required, like that. Then documentation of minutes of meeting. So the secretary is supposed to document the MOM. Then action plans with defined timelines. So if you just do the committee meetings for the sake of it, even maintain a MOM and circulate it, discuss everything, but you don't do anything, you don't follow up, you don't make sure that those things which you discuss, they are done. If you don't do that, then the committee work will dry down, people will get demotivated, and all this system will break down. So the secretary is supposed to see that all the points, action points, they're all done. So the secretaries, they are also assessed, scored on the basis of how many points were discussed and the percentage of points which are complete. Okay. Then review of previous meetings. So what was discussed in the last meeting, that needs to be rediscussed. So these things were discussed and these many points have been taken care of. Those points are done. These many points are left. Okay, and then the further point of action. It is essential that the committees, they work in continuity. So like this GIF that you can see, a perpetual motion. Okay, so it does not work like you did something and it goes on automatically. You need to put efforts. The secretary needs to put effort, and the quality team, they ensure that they do their work. Okay, so there are basically two things with which you can ensure that the committee follows continuity. One, committee meetings tracker. So in one sheet, what you can have is the list of committees, the frequency of meeting, and then months in the columns from January to December or April to March, whatever you feel comfortable with. So in that way, every month in one sheet, any time of the month, any time of the year, you can see that which committees they have done the meeting and which committees they have skipped. Okay, so every month during certain day you need to track those. So it is advisable that all committee meetings, they finish the committee meeting by 20th of every month, and then in the next 5 days the quality committee and the management committee, they will have their meeting. Okay, second point, committee MOM action taken scores. So after every committee meeting in the MOM, there will be quantified point of actions that needs to be done. So after every meeting, the last meeting's points, say for example there were 10 points discussed. So out of those 10 points, how many points were done? So accordingly the committee will be scored. So once you start doing that, you'll know that how effectively the committees they are working. And if you link that with the secretary's annual appraisal score, then the secretary will be more motivated to do their work. So this is how you ensure the perpetual motion of committees. Now we start with committees. The first committee, biomedical waste management committee. So this needs to be need to do the meetings every month. So here you discuss about the proper segregation as per biomedical waste rules latest. So the committee, they ensure that all this segregation work, they are all done in the right way and it is monitored well. Then ensure proper transport. So segregation is there, how they are segregating in each department, and then how it once the bins are filled periodically on daily basis, how these biomedical waste they are transported to the storage area. Then ensure proper storage proper storage. So proper storage as in how these biomedical waste are stored. So the storage place, it should have 4 different storage compartments: yellow, red, blue and white, and separate for the general waste, okay, in green or blue. What you also need to ensure is the old biomedical waste, it does not get stored, and it has to be you have to follow first in first out. Okay, first in first out. So what goes in first, it has to go out first. So that has to be ensured in the storage area. Then any supplies or any infrastructure related changes that is required, like how many say for example certain supply gaps are there, certain infrastructural gaps are there, your segregation area is not proper, you need to clean it, you need to make certain decisions. So all those points are discussed in this biomedical waste management committee. And another thing you need to discuss is the licensing part of the pollution control. Okay, how much waste you have got, how much for each category, how many kilo of waste you are producing and you are disposing. All that needs to be discussed over here. Next, what we have is infection control. So in infection control, first you discuss about infection related quality indicators. So quality indicators like hand hygiene compliance, your CLABSI, COTI, VAP, SSI, all those indicators you need to discuss. And you have to take corrective and preventive action if your infections are going high or your hand hygiene compliances are low. Swab culture reports. So any deviations in the swab culture reports, so for OT, ICU, labor room, NICU, any deviations, any growth that is found, or any superbug if you get, or any infections which are going on and you are not able to you're not able to mitigate that, those things you need to discuss in the committee meetings. Then comes your outbreak detection and control. So any possible detection of outbreak, how do you handle that? What corrective action, preventive action, what are the root cause for those? So RC and kappa, all those needs to be discussed over here. Any implementation of infection control practices. So all infection control related practices, everything to do with infection control practices, all and its compliance, everything is discussed over here. Then the committee needs to ensure that staff vaccination coverage is done. So all new staff, they need to be vaccinated within the first month itself. Sooner the better. You can keep a target whenever a new staff joins, you have to get them vaccinated. So another thing you can do is you can have one day fixed in every month, for every month, where all new staff of those all new staff which are joined in that month, they all get vaccinated in the same day. Then ensure implementation of antibiotic policy. Okay, antibiotic policy with antibiotic stewardship program, all these things are taken care by the infection control committee. And anything to do with supplies or infrastructural changes. So infrastructural changes recommended by infection control committee, like for isolation, for OT, CSSD, all those points are covered over here. Okay. The MRT committee. So MRT committee, they discuss about the active audit findings. So active audit is happening every day, and the last month's active audit analysis report, that needs to be discussed in the MRT committee. Okay. Then it has to be tallied with the passive audit, as a passive audit as in which is done by MRT team. Then nursing audit finding. So nursing audit is done by the matron, the CNO or NS or assistant nursing superintendent, whatever you say, the head of the nursing. She does this nursing audit to cross verify with the active audit and passive audit findings. Okay, so whatever indications, which findings of these audits, they are all discussed, and certain corrective actions, those are all discussed in the meeting. Improvement of all indicators. So the overall improvement of these indicators, these are all taken into consideration. These are discussed, their solution is discussed, and it is discussed to it is assigned to certain people, and then the work of those assigned tasks, these things are monitored in the meeting, MRD committee meeting. Okay, then issues of missing records. So if there are issues of missing records, certain incidents, undesirable incidents, those are all discussed in the committee meeting. What needs to be done ahead after any undesirable events in MRD, those are all discussed. Storage and destruction decisions. So if the MRD, they are facing with storage issues, they are the storage racks are less, there are certain decisions to do with destruction. So the committee, they have to decide on that we need to, okay, we say let's destroy the medical records from this to this year, from this IP number to this IP number, and the action that needs to be taken, the decision that okay, let's go ahead with that, is done in the MRD committee. Then any electronic medical record issues, those are all addressed here. Any issues, challenges and suggestions, those are all taken in the committee meeting. And any supplies or infrastructural issues which are there in terms of medical records, those are all discussed here, and a proper solution is discussed and it is implemented. Okay, so thank you for watching this video till the end, and please comment your views, like this video, subscribe my channel, and share this with your team, and keep watching this channel. So see you soon. Thank you.